Hello viewers. Welcome to our YouTube channel. Today, we're going to dive into some fascinating new research that sheds light on the potential connection between playing football and the risk of developing Parkinson's disease. So keep your focus here, let's get started. Before going ahead, if you're new to our YouTube channel, don't forget to hit the subscribe button and ring the bell icon. That way, you'll be the first to catch all our informative videos. You know, we've always loved watching football. The excitement, the camaraderie, it's a beloved sport for many. But did you know that recent findings from the Boston University CTE Center suggest that playing football might actually increase the risk of developing Parkinson's disease? This study, based on data from a large online survey sponsored by the Michael J. Fox Foundation for Parkinson's Research, discovered something quite interesting. Participants who had a history of playing organized tackle football were found to be 61% more likely to report a Parkinson's disease diagnosis. And not just that, the risk was even higher for those who played football at higher levels, like professionally or in college. They were nearly 3 times more likely to have Parkinson's compared to those who played at the youth or high school levels. Now, you might be wondering how football could be linked to Parkinson's disease. Well, let's break it down a bit. Parkinson's is a brain disorder that leads to involuntary movements, difficulty balancing, and stiffness. It's still not completely clear why it occurs, but this study points to a possible connection between repetitive brain trauma, like the hits and tackles in football, and long-term consequences on brain health. Interestingly, this study actually began with a look into the connection between boxing and Parkinson's disease, as there's been a known link between the two since the 1920s. But what's fascinating is how similar the repeated hits to the head in both boxing and football could potentially lead to neurological issues. Now, the researchers found that the longer a person played football, the higher their odds of developing Parkinson's disease or Parkinsonism. This was especially true for those who played for 5 or more seasons. And guess what? The study focused on amateur players, making the findings even more impactful. But there's still a lot more to learn. Doctors are still trying to figure out exactly how these brain disorders arise from playing football. One theory suggests that repeated heavy hits to the head could cause inflammation and damage to the brain's white matter, leading to chronic inflammation and ultimately increased risk for neurodegenerative diseases. Now, I want to emphasize that this study doesn't definitively prove that playing football causes Parkinson's disease. It highlights a correlation, a general connection between the two, but there's more research needed to establish a solid link. So, what can we do about it? Well, experts recommend some important steps to make contact sports like football safer. Delaying tackling in youth football until high school could give young brains more time to develop and reduce the overall impact they have to endure. Also, minimizing hits during practices could significantly lower the risk of brain injury. But, of course, it's not just about the players. Coaches and parents play a crucial role in making sports safer. Ensuring that teams have up-to-date equipment, proper coaching techniques, and on-site medical staff are important precautions to take. In the end, while football and other contact sports have many benefits, we need to prioritize brain health. So, let's continue to enjoy the excitement of the game, while also being mindful of the potential risks. Thanks for watching. Stay tuned, and subscribe to our YouTube channel.